On Sunday the 22nd of March, Wales announced full lockdown in an effort to combat the spread of coronavirus. On Monday the 23rd of March, the kidney community in Wales were left wondering what happens now. In answer to that, Susan Spence, Network Manager, and Gail Williams, Lead Nurse of the Welsh Clinical Renal Network, pulled a team together to work collaboratively to support our kidney community in Wales, to understand the guidelines from Public Health Wales and the Welsh Government, and learn what services were available to them. That team consists of, from left to right in your picture, Gail Williams, Lead Nurse of the Welsh Renal Clinical Network, Lee McGoughlin, Research Officer from Wales Kidney Research Unit, Lindsay Isaac, Patient Support and Advocacy Officer, Kidney Care UK, Judith Stone, Managing Director, Kidney Wales, Karen Jones, Renal Social Worker and Chair of the Health and Wellbeing Group, Joanne Popham, CEO of the Popham Fund, and Susan Spence, Network Manager, Welsh Renal Clinical Network.
The multi-professional team assembled to work on the COVID newsletter were from diverse backgrounds: nursing, commissioning, research, patient advocacy, renal social work, and 2 chief execs representing Welsh renal charities. Collaborators had the same person-centred objective: to support and inform dialysis patients and their families through COVID-19. Each collaborator brought specialist knowledge, skills, resources, and most importantly, bundles of enthusiasm. The focus throughout has been to ensure patients know how and what to do to keep themselves safe, also promoting ways for patients to manage their physical and mental well-being. We are grateful to members of the wider renal MDTs who contributed to the process. Working collaboratively has enabled the same information to be distributed to all renal dialysis patients throughout Wales. The newsletter is a positive outcome of COVID-19. As a result of it, we have a new alliance for future working relationships, which can only be positive for Welsh renal patients and their families.
At the outset of the pandemic, all 3 charities experienced a significant increase in the number of inquiries from patients and families who were reaching out for expert information, guidance and support. Our teams were able to respond with empathy and understanding, and working closely with each other and with colleagues from the renal network, clinical staff, social workers and psychologists, we were able to provide appropriate support. During March to August, the 3 charities directly responded to 469 phone and email inquiries from Welsh patients. The next slide will summarise the nature of those inquiries. Our communication channels, our websites, social media, webinars and newsletters also increased in importance as a means of quickly and easily sharing information in a rapidly changing context. Working closely with predominantly social workers and psychologists, the charities also made grant payments of almost £25,000 to patients and families who were identified as being in need of urgent financial assistance. The grants were for a wide range of items, including freezers for people who were shielding and needed to limit shopping trips, washing machines, food vouchers, payment of rent arrears and utility bills, adaptations for home therapies, and wellbeing packages to help patients cope with the stress and anxiety caused by the situation. Through these grants, the charities sought to work alongside social workers and psychologists to help to minimise the non-medical pressures on patients and families caused indirectly or directly by the pandemic.
As you can see, there are a wide range of reasons why a patient or carer would get in touch with our charities or their renal social worker. They might need support with a benefit such as personal independence payment, or would like information on treatment choices, or even just want to talk to someone non-medical about living with chronic kidney disease. Together, we all provide holistic support to ensure that their psychosocial needs are met along with their clinical needs. Over the last 6 months, we have all seen the nature of inquiries changing as the COVID pandemic led to shielding and a new way of life. We have seen an increase of patients getting in touch for support with employment, access to food shopping and financial assistance. We have also been speaking to patients who need clarity on social distancing guidelines, how their treatment will be affected, and whether it's safe to return to school or work. Unsurprisingly, shielding patients have been feeling isolated, and we have been offering support either as formal counselling or peer support through online channels. Health and well-being has been a common theme, with patients seeking advice on diet and exercise too. Kidney Care UK launched an online advice page in early March to summarise all of the information available at the time for kidney patients who were worried about the growing pandemic. Updated regularly to reflect changes in regional and national guidelines, the page covers public health guidelines, information on what to do if you have symptoms, and the measures in place for shielding people, along with advice on employment, schools, and travel. The page was visited more than 150,000 times in the first 2 weeks prior to the shielding announcement and has been viewed over 500,000 times to date. Thanks to NHS staff and the renal community sharing the page with patients, we have been able to ensure that information remained consistent for kidney patients. Alongside this, we have also been producing blogs from our counsellors, advocates and patients on managing anxiety and fear, coping with time at home and ways to stay connected. We have also been running a series of webinars with the Renal Association where patients can have their questions answered by clinicians.
During the pandemic, from the 23rd of March 2020, the Popham Fund developed our services, which will be carried on and continue to be developed post-COVID-19. The Charities Care Line was manned by the Charity Support Services Coordinator. In response to the pandemic, we asked our peer mentor team, who are volunteers with kidney disease, who are shielding themselves, to man the care line, so we were able to continue to provide the peer support service. We opened the care line from 9 a.m. to 6 p.m. Monday to Sunday and created a rota system for the volunteers to take the calls. Post-COVID-19, the care line will continue to be manned by the volunteer peer mentors. The charity's peer support service is currently provided under Swansea Bay University Health Board and Cardiff and Vale Health Boards. Our feature aim was to develop this in North Wales. Due to the virtual digital accessibility during COVID-19, we've been able to develop the service in North Wales by promoting the care line through the collaborative COVID-19 newsletter. We've also been able to develop the service to train and provide parents and carers with peer mentoring, and we are now looking to develop a youth service during this time. Our counselling service was developed to provide telephone-based counselling. We have counselled 9 people with kidney disease and developed a virtual mindfulness session for units. Post-COVID-19, we will be developing a trauma and bereavement support groups. Prior to lockdown, we were running various support groups called kidney cafes. When lockdown happened, we quickly turned these services to an online support group. We ran a kidney cafe for parents and carers, post-transplant patients and home therapies. We've also been able to run monthly virtual group sessions that have been supported by a guest speaker, a clinician or peer who have been able to instill confidence and peace of mind in our cohort who have been confused about the information from Public Health Wales and the Welsh Government when trying to put it into context to ensure their own safety and well-being and that of their families. After the pandemic, the online support groups will continue to be a source of information for our cohort. We will also be developing a pre-dialysis surgery in the same vein currently, which will then become a face-to-face offering after the pandemic, and also unit-based kidney cafes. During this time, we have recruited volunteers to deliver essentials. This is a new service, our buddy service, which will continue post-COVID-19.
To safeguard the longer-term future of the charity, Kidney Wales placed 5 members of staff on furlough for the duration of lockdown, reducing the team to 3, whose focus shifted to keeping people informed of the latest information specific to the interests of kidney patients in Wales. As an initial emergency response, a closed Facebook group was established, the Kidney Wales Facebook community, where regular information updates are shared. This group now has almost 500 members and is an important communication channel to reach patients and families, particularly those who have been shielding. Through the Facebook group, we hosted 6 live question and answer sessions where patients submitted questions in advance. 4 of these were kindly hosted by Dr. Mike Stevens, providing the latest information and data relevant to kidney patients. The most popular session was in June, regarding the update to shielding, which received over 1,200 views. We collaborated with Citizens Advice and a psychologist to host 2 further Q&As on welfare and benefits and managing stress and anxiety as we moved out of lockdown. Combined, the 6 sessions were viewed over 3,000 times, and the feedback from patients and families confirmed how valuable the sessions were in providing accurate and trusted information. In comparison to 2019, our website traffic doubled during the pandemic, and so we focused on posting regular updates, which were multiplied through our growing social media channels. We ran 3 campaigns. Firstly, Nominate a Hero to recognise and celebrate healthcare professionals. Secondly, a face covering campaign with 2,000 units distributed to patients and families all over Wales. And thirdly, we sent 1,500 life-saving fistula caps to the vascular access specialist nurses across the country. We also continued to fund the part-time specialist renal child psychologist post at the Children's Kidney Centre, offering a vital resource to supporting families throughout lockdown, and we continued investing in 4 active research projects.
As the extent of the COVID pandemic became clear, and particularly in relation to the vulnerability of patients on unit dialysis, Gail Williams contacted the leading charities for Wales, and soon afterwards the All Wales Health and Wellbeing Reference Group and the Wales Kidney Research Unit to support patients and professionals during the crisis. We recognised the need to ensure that patients received calm, accurate and consistent messaging. Digital literacy is a recognised issue within this patient cohort, so the working group worked to develop a series of newsletters that are aimed at being both informative and reassuring. The aim was to distribute directly to the patients to read whilst on dialysis and take home with them as a reference document. Each newsletter contained latest COVID guidance, signposting to resources, expert advice and tips for mental health and well-being, overall support services, and how and where to access them. We also included content to inform patients of key health service programs, such as advanced care planning and improving access to home dialysis, as well as opportunities to feedback and contribute to future content. We did this by meeting virtually once a week. The group fed back on the issues they were encountering from patients, which became the theme for the following newsletter. We paid for professional graphic design and to date have released 8 newsletters, with 2 more in planning to take Welsh kidney patients into the new normal. Feedback has been really positive, and we especially note that staff have come to really value them, as it provided an opportunity to interact with patients to support their overall health and well-being. We report some shared learning, that it took time for the purpose and intention of the newsletters to become clear, and we encountered some barriers with getting the newsletter into the patient's hands, as on reflection, many professionals did not fully realise the importance of the content of the newsletter due to adjusting to COVID working, and reports that there was so much other information out there that it took time for the newsletter to find its way through the noise as the authority, having the most up-to-date guidance and key resources presented specifically for these patients. All newsletters are available via the partners' websites. Links are at the end of this presentation.
During the pandemic, the Popham Funds, Kidney Wales and Kidney Care UK collaborated on joint virtual projects to support the kidney community in Wales. The 3 charities came together at the end of 2019 with the aim of organising and hosting a joint patient education conference in South Wales to be held on the 12th of June 2020. Due to the pandemic, this was cancelled with the aim of reorganising in 2021. Until there is confirmation from Public Health Wales that we can organise and hold an official conference, we decided to organise a series of virtual conferences to keep you updated with the guidance and services available during this time. Our first virtual conference took place on the 2nd of September, titled COVID-19, the New Norm for Kidney Patients, with the aim of providing advice and guidance as patients come out of shielding. Fiona Lau, Director of Policy, Kidney Care UK, discussed the main concerns raised from a joint survey called Worried Sick, and Mike Stevens, consultant transplant surgeon at the University Hospital of Wales, provided advice and guidance following on from the concerns raised in the survey. You can view this on www.kidneypatientconference.wales. The COVID-19 newsletter was started to support patients who could not access information online. The collaborative team discussed how we could support them to become confident to access digital information. The team came across a company called Phones for Patients, who provide devices for patients for free. They provided the team with 54 iPod Touches, which have been distributed to all dialysis units in Wales, with the instructions of how to use them and what they are to be used for. They were distributed in time for the virtual conference. We will monitor and evaluate the device's use with the aim of developing this further in the future. Kidney Care UK carried out a survey throughout UK called Worried Sick to find out how patients managed during the pandemic. The 3 charities decided to come together to run the survey in Wales, which was the main theme for the virtual conference. The full reports can be found on each of the charities' websites.
We hope this presentation has informed you about the work of our collaborative network throughout the pandemic. The 3 main Welsh renal charities, Kidney Care UK, Kidney Wales and Popham Fund, are not only here to support patients, but also to support you as healthcare professionals. What can we do to help you in your work with patients? Please contact us directly to let us know how we can help. We also need you to work collaboratively alongside us to provide the best possible support to patients and families. Here are 4 suggested ways for you to consider working with us. 1. Please refer patients to us, be that for information, guidance or peer support. 2. Let us know about patients who need urgent financial assistance. We only give grants on the recommendation of professionals. 3. Please consider working with us to deliver an expert information session. Could you speak to a peer support group or deliver a virtual presentation or question and answer session? We'd love to work with clinical teams from all over Wales, so please get in touch. 4. Please spread the word about our services, be that through information leaflets or sessions in your clinics, education materials, training or events.